Hey guys, welcome back to Dental Talk 360. Today we'll be talking about designing smiles and what is cosmetic dentistry.
Once again, Fetty, here you go.
Cosmetic dentistry to me is the reason I became a dentist. Changing someone's life through their smile. We've all had patients that cover their mouths up, that are ashamed of the way they look, they smile, their teeth. They probably had bad past history of circumstances where, they had issues and now it's causing them to have pain or aesthetically not happy, or they were just born with deformities in their teeth, staining in their teeth that make them unhappy. And it causes people to have depression and social anxiety and not allowing them to look for jobs or love life. And I've been very fortunate in my career that I've been able to help patients that have had these issues. And it's life-changing. It's amazing when you get someone and they give you a hug and they said, "You changed my life."
Yep.
Through designing their teeth.
Mm-hmm.
Yeah. Let's repeat that. They're designing their teeth, but aesthetically driven to their face, right? Because we've all seen dentists that do teeth that don't look natural. And for some patients, that's what they want, right? However, all of us can agree in this room that we do facially driven aesthetics to make teeth look as natural as possible to mimic nature.
Correct. Yeah.
And to make them, enhance them, and make them feel good, happy, and look fantastic and amazing.
Yes,
and
right.
function properly.
Mm-hmm. Yep.
Because some of these cases that you'll see will be ultra white, they'll look like chiclets, and there's no function, which leads to them breaking, which leads to infections, which leads to gum disease, which leads to a rabbit hole of problems.
But that's the whole point is, first, I think we should bring it back to what is a cosmetic dentist. A lot of people think that cosmetic dentistry is just about veneers and making a smile look good. And a cosmetic dentist is someone that that has gone through a lot of training, not just into designing a smile, but into the occlusion, which is the bite, into the perio, which is the gums, into the prosthodontics, which is how teeth should function with each other. So a cosmetic dentist is a comprehensive dentist that has knowledge of all fields.
And also on top of that, to go towards your mentors, which is Dr. Michael Appa, to have the vision of where the teeth should go and what the teeth should look like.
Yep.
Right?
Exactly.
Because the patient can't dictate what the teeth should be. That is our job. But it's our job to also get the training to be able to visually see where things go using line angles of the face, facial dimensions. That all changes things.
Correct. Yep.
Right?
Yep.
Creating harmony in their bite and their smile and in their aesthetics.
Correct. So first, a cosmetic dentist need to have this type of trainings in all fields of dentistry. So it's kind of sad that there's not a specialty for cosmetic dentists.
Right.
Yeah. But we have, myself, I have spent hundreds and thousands of dollars just to get the training that I need to be able to do the type of work that I do. Now, once you have this type of training, you can help a patient transform their lives. And now we get into the field of aesthetic. And that's different because everybody, their definition of what is aesthetic to me might be different, to you might be different to another person. So for me, I will be okay with some of the cases that I see, like maybe they're not as beautiful. It has to do with the ceramics that you're using. It has to do with a lot of things. But as long as you have that function part of it and you have taken care of the health of the mouth, then the case is a success to an extent. Now, in our office, we work very high end. So we're lucky enough to have our own ceramics in-house, some of the best ceramics in the world that actually, they teach other ceramics to be ceramics. And then we have, like you said, Michael Appa is a visionary. So he can, the way that he looks at you that's just your taste. So one of the things that we do, and that's why our cases are so unique, is that through our temporaries, we shape them and make them look our way. So we give our touch of art to them. and then our lab replicates. So that's how you can differentiate yourself from other dentists.
Yeah, you're creating the blueprint from
Yep.
your background and expertise to give them an aesthetic enhancement, functional correction, to give them that smile. But the key is the temporization
Yep.
phase.
Yep.
And that's where some dentists
Get lost in the
get
sauce.
lost.
In
Yeah.
that phase, especially in terms of the design, something that I think really makes you a great cosmetic dentist and a provider is Dr. App was talking about this with us. Sometimes we want to make it our case. I want it the way I want it, but we're doing it for somebody. So you need to be able to kind of remove yourself
Yep.
from not the thought process, but from the reactions, because you think you did an amazing job. Patient had a completely different thing in mind. So part of it is being able to see what will look good, size, shape, color, but then being able to listen to a patient and what they are telling you and be able to dentally translate that into their mind.
100%. And that's the biggest problem.
That's the biggest thing.
I agree.
So like working with, we're blessed to have an in-house ceramist, and working with a ceramist is like having an artist on commission. And sometimes the artist wants to incorporate certain things like translucency and these line angles, but when you look at the face as a whole, you can't do these things because then you have a short tooth with translucency. It looks like
Yeah.
little baby teeth.
Yeah.
You can't do that. So when I sit down and I talk with, Stefan, who is a phenomenal ceramist, and we go, listen, Stefan, I know you want to put translucency on here, but we can't do that. You're the artist on commission. We got to work together as a team to make this patient happy. So there's going to be no translucency on this. But
I think we should also take it a little bit further back because a lot of patients watch this podcast. So we're going to walk you through the whole process of what it means whenever you go get some dental work. So essentially the protocol that we have and veneers or ceramics or crowns or rehabilitation, it can be for any age of patients. A lot of people think that you get veneers just for aesthetic, and you're wrong. It's mainly for function. So there's a lot of young patients or a lot of young people, 30 years old, 35 years old, that have a lot of wear, a lot of breakdown on their mouth. So by getting this type of work, we are taking the time clock back, and we're preventing further destruction, because they have been going through, at an early age, you shouldn't have this type of destruction. So we get a lot of patients that have a lot of wear, 30 years old. And then we do end up doing a lot more work that a lot of dentists kind of look at us and they're like, oh, these guys are so aggressive. And we're really not. We're actually fixing the issues so that we prevent further destruction.
The patient actually did the preparation
Exactly.
for us.
The patient destroyed most of it. And if you do not take care of that and you let it happen in 5 years, in 7 years, you're going to be at a worse place.
Yeah.
Yeah.
So sometimes
Seeing the big
more
picture.
is actually less.
Well, it's like if you had a leak in your basement and it was just a small leak, which is a little bit of tooth wear, here, one little chip there. You say, it's fine. Nothing's going to happen. Then the basement floods. Then you're breaking teeth left and right. Now you're losing teeth. You're getting implants. And that's a whole different route of dentistry rather than basically a porcelain cover to
Exactly.
restore the destruction.
And just for the patients, when you have severe wear and you've worn your teeth down, you look at pictures of yourself, say when you're 15, 18, and now your teeth look half that size. When it comes to us designing, preparing, we're really adding.
Yep.
We're not subtracting. And that's a thing that patients have to understand, because they're always worried about, you're going to grind my teeth down. Am I going to be in pain? And a lot of times the answer is no, because I'm
touch your
actually
tooth.
adding
Yeah.
to what you already lost. Yes, there's going to be a level of preparation for the ceramics,
Yep.
right? But which we can control through our design process, which we'll get to, and our temporization phase, which we'll get to. But that causes minimal preparation design, meaning I'm not going to grind your teeth down to stumps like you'll see in some people that go to different countries, they get their stuff done and they're all pegged out. That's not what we're discussing. We'll be adding to that situation. Sometimes when I'm full mouth rejuvenation that I've done, I prep nothing. Sometimes.
It's all additive. Yeah.
It's all additive.
Yeah, so you're barely touching your tooth. So when we say
Correct.
prep, we mean grinding down. That's how much
Yes.
most people know it. So I'm going to walk you patients through our protocol, and dentists too. So stay tuned.
We have a good person that can walk us through
Yes,
that.
we will walk her through it. She's going to tell us her experience. So essentially, whenever you go I'm gonna just describe it. Whenever you go to a dentist, they're gonna work on your teeth, do a design or whatever. So the first thing is the initial consult. You're gonna go in. We're gonna take photos. You're gonna take X-rays. We're gonna make sure that health is it's okay, that bone is okay, that everything is good, and then you go into the next stage, which is the restorative portion of it. In this portion, we plan the case prior to doing it, prior to touching it. So planning before. This can be done either digital or analog. Analog meaning waxing and creating this new vision, or digital, the same thing, but just done on a computer. So dentists, you have those two options. There's not one way that's better than the other. I think a combination of both is what's ideal. I used to be very digitally driven, everything digital, and now I'm combining both, and I'm finding a lot of success doing that, and it's an expedited process. So once we design your smile, I always tell the patients, I'm gonna take your input and my vision, and I'm gonna combine it, and I'm gonna give you something that I think is ideal based on what you want. But at this point, you come into that appointment, we prepare, you leave in temporaries, you come back the next day. And at that stage, you tell me what you'd like or did not like of the smile. And at this point, this is a material that is resin, so you can add, subtract. We can completely change what the vision that we gave you if you didn't like it. Most people don't have an issue with it. And then after this happens, your lab, you get sent to the lab so that they can make the final restorations, and they're just gonna copy. If you have a good lab, the lab is going to copy.
Yeah, they're gonna do
what
a
you
1-to-1.
made. 1-to-1
what you
ratio. It's just, the porcelain is gonna be obviously nicer, more details into it, better color. The other one is a temporary plastic material. So that's somewhat what most people should be following, dentists, whenever treating a patient.
Yeah, and then you're adjusting little things, and also the bite.
Yep.
So the importance of that 1-to-1 and the being a replica of what you have is for the lab important, because then on the final ceramics you're not doing any adjustments.
Yeah.
If any, very rare.
Minimal.
And the patient knows exactly what they're getting.
get, yeah.
Now, obviously, with more life, it's porcelain. It's not going to stain, and it'll just look phenomenal. But the key is that test drive, and being able to come in the day after your temporizations to make final adjustments, so that then not only is the patient happy, but the dentist is also happy that the function's good, that everything's in harmony, so that when that gets sent to the lab, that gets made in a 1-to-1 full replica of what the patient had. Now then color then has the conversation.
Yep.
Right? Do we want to go a little bit into color?
Well, I was just going to add with the 1-to-1. I think that step, every step is critical, and all the communication is critical. But the 1-to-1 make my temporaries is, one, you have to have the ability as the dentist to shape it to how the patient likes it. And a lot of people will say, the lab will fix it.
Yeah.
I'm gonna
can't do
I'm
that,
gonna
right?
send
Big
I'm
no-no,
gonna
yeah.
send them temporaries that suck. They don't look great. And then think the lab can make this look better. The patient comes back and you have no clue what's coming back from the lab.
But why
you're
is that?
guessing? I think it comes down to, some dentists don't care.
Nope.
That's part of it. But if you don't have the ability or go get the training to do this properly, you've never been taught
And-
the right way to do it.
And also
the
the
challenge that I
lab,
have
the
for
lab
dentists-
doesn't
go
have the
ahead.
patient there,
Correct.
right?
Yeah.
They can't do it in the mouth.
So
if you're
That's
adjusting
where the photos,
exactly
the temporaries, the models.
Yeah.
It's even if it's like you said, the ceramic brings it to life, but that temporary with the photo and the model combined, that's their 3D spatial awareness.
it was adjusted
That's the only thing they
in
have.
the mouth to your patient.
Correct.
The lab is going to have a bench top. They're not going to have the soft tissues, the lip positioning, or anything like that, because that will change the aesthetics of somebody if they add too much, too
Exactly
little.
right.
And that's another critical step. That dentist needs to be able to have the vision, do it in the mouth, so that then the lab could just worry about making the ceramics.
Correct.
Exactly.
Correct.
And a challenge that I have for dentists is start getting a design back from a lab. Get your wax, try it in, bring that patient back the next day, or even that same appointment, and modify it. Do something to it. I don't care what it is. Just do something to that temporary. Bring back your patient the next day, and I want you to add, to subtract, to take a look at that patient from far away, fresh eyes. Take a photo. Take a photo of that patient. Sit down in front of a computer before you walk into the room and take a look at those temporaries and modify them and start putting your touch into everything that you do. Become an artist. And I'm telling you, with time, you're gonna get better at it. This whole week, you can ask Vince. Vince and I, what did we do? We went to the office when the office was still closed under construction, in a way. And after hours, we were waxing. We
Wax
were
ups and
creating
mock-ups.
wax-ups and mock-ups. That's what we decided. We want to start creating and putting our touch into everything that we do. So do that and then find a lab that is going to replicate what you do.
Yep. And you guys motivated me this week because I also did some waxing.
Good.
Stefan in our lab looked at me and he saw me over there finicking around with the wax. He's like, "What are you doing?"
I
Like, I'm
mean, it
just
all comes
doing
down
wax
to
up.
how passionate you are about your work.
Yeah.
You know, some people are just about the minimum. This is what, you know, I'm supposed to be doing, and I'm not going to go further. You know, I'm not going to learn what's
Patients can
behind
feel
it.
that though.
Yeah.
Yeah.
They can
You
feel
have
if
to
you're
practice.
passionate.
When
Yeah.
you're 100% involved and
Yeah.
you know every step, every single detail, you know, like when you get to a management position, it's because you have already been at every layer,
Correct.
Yeah.
you know, so, but not everybody's like that. Not everybody's,
But it's about repetition and practice. For example, I'm going to use Tom Brady because it's your mentor's favorite athlete. Tom Brady on vacation is practicing.
Yep.
Yeah.
Tom Brady on vacation is bringing his wide receivers to
Yeah.
practice routes. Why? Because he wanted to be great.
Yeah.
And guess what?
Exactly.
He is the greatest of all time.
Yeah.
So
There's
funny,
no question.
The craziest thing is I met Dr. Rosenthal back in 2016, and one of the greatest pieces of advice he gave me is as soon as you meet someone, start designing their smile in your
100%.
head.
Do 2D.
Yep.
2D if you
and
need
then when you talk to them, you know, you ask them like, "Do you love your smile? How do you feel about your
to.
smile?"
Yeah.
And they go, "Oh, well, this. Oh, yeah, I think you should do this, this, and this." And like, "Oh my God, like
He already,
you already know what you're doing."
yeah.
Yep.
And then that's how actually I got a lot of my patients was just at the bar, hanging out when I used to live in DC. I mean, like every bouncer, bartender, bottle service girl, I did veneers on them. And then now I'm out here in Miami doing the same thing. We were there last night. We were at Casadonna, and I'm, you know, this girl was nice. She was just like, "They've been waiting. Go get their drinks first." And I'm like, "Teeth, space in between 7 and 8. A little bit of ortho, extrude this."
But again, that comes with time and practice, right? You got to visualize it. So the moment that you could see it,
Yeah.
then it becomes easy.
Yeah.
You
But
know?
that's the whole practicing, though, because in your mind, if you can see it, like Appa and Rosenthal will tell you, don't pick up the handpiece unless you know you're going with
Yep.
this.
Yeah.
Exactly.
Because if you don't know where you're going, you're going to end up down the wrong
You're
path.
basically going with the end result in mind.
Yeah,
right?
exactly.
And that's the key.
Got to
Yeah.
plan
You're
it
really
first.
reverse engineering your
100%.
prep
Yes.
because of where you
Yeah.
want to go.
100%.
The
Exactly.
biggest mistake dentists have is they expect that wax up to be the final. But if it's an
Yes.
additive reductive, you got to get the arch form straight. You can't just put the wax up in.
You have to prep for the ceramic.
Yeah.
100%.
And sometimes we say prep, sometimes prep means no prep.
Yeah.
Yeah.
So you have to know what your angle is.
Like
a lot
a
of people sit down.
luminaire?
A lot of a lot of dentists like sit down. They're gonna go through a case, and in their mind, everything is numbers and step. Like take it all back. Take a look at everything.
Yeah.
You know, put that mock-up in. See what it looks like. See if you have to reduce or not. Everybody's like, "Oh, I need 0.5 millimeter, 0.3 for porcelain, blah, blah. Let me reduce this tooth." But you're adding to it. Why do you reduce? You know, you didn't have to touch that tooth. So
You know, it's funny you say 0.5 because that's what differentiates. Like in dental school, we all had those people that got the 4.0s and just not clinically, but book smart.
Didactically.
Yes, but when it comes down to cosmetic dentistry, you have to have the hands and be able to communicate what the patient wants into their mouth. Forget about the 0.5 or the 0.3 or the 0.2 and then the X, Y, Z, all the science. If you can't translate that to the patient, it's
But that's the
pointless.
art. That's the art in it.
What are you gonna say? But I graduated #1 in my class. It's like
you're gonna
that
have
doesn't
all the
matter.
knowledge. If you
So-
don't know how to put it in practice.
So last weekend was a monumental weekend.
Yes.
We had Appa
Yes.
Aesthetics, Dr. Michael Appa,
Yes.
DSD,
Yeah.
Dr. Christian Coachman lecturing for 2 days, and they lectured
Oh,
hard.
22
Yes.
hours.
A long
22 hours.
22
Yeah, I
hours,
should have
which
gotten
was
22 hours
amazing.
for that. I didn't
Yeah,
get
we got
22 hours.
Yeah, I
CD.
wish I got 22 hours. See, Fred. I put in my certificate and I saw I only had 15. I was like, what? I was there for a lot longer. But can we just unpackage how amazing
Yes.
that weekend was
Yeah,
and what
yeah,
the
yeah.
greatest take homes were for each
Yeah.
one of us?
Yeah.
Yeah.
What are some of your favorite take homes?
I think everything both of them said, it was cool seeing a full digital mindset. And Dr. Appa is more analog with some digital mixed in. So you can pick things from both. So I think the first thing that I really took home was the hybrid model of dentistry, meaning analog plus digital. Finding the blend that works best for you is going to be the most efficient way, best for the patient, best outcome.
Yes.
But in terms of the biggest take home that you can immediately apply into your practice for the patients, it's all about the patient experience.
Yeah.
If you have an office and in your head you're the best dentist ever, amazing, everything you do is technically perfect, but your environment is horrible, nobody cares.
Yeah.
No.
True.
Respectfully, nobody cares unless you are able to deliver an experience to the patient that makes them say, you know what, this is the guy or this is the girl that I want to do my teeth and really change my life.
You know, most dentists don't put themselves in the waiting room and go through the process.
The flow. Yeah.
They don't.
Correct.
So it'll be, you know, I know it's harder because you work there, but I would really urge a lot of these practicing docs to really go through that whole process to see how it feels
Exactly.
for them to be a patient and then understand how you can change, right?
Correct.
And that's what makes your practice, our practice so special. It's
Yeah.
we really work so hard to create systems to make that patient experience exceptional.
Exactly right.
You know, the funniest thing is when I joined you guys, Craig was like, you know, this is the Ritz-Carlton of dentistry. And I'm like, Craig, I've never stayed in a Ritz-Carlton.
What about you, Oscar? What was your take home?
I mean, for me, it was about, and it's something that I always force myself to do. Is always whenever you go to any conference, anything that you go to, I like to go in with an open mind and just be able to listen to what they're saying, and not be about trying to prove my point or not prove my point. So before I started working at Aesthetic, I was fully digital. I did everything digital, and for me that was the future. It's the future. Digital. We got to do digital. And then I was like, oh man, when I started in this office, they do a lot of stuff that is like analog. And then when I started working there and I saw the reason why they do certain things, and sometimes it's faster, it's to expedite it. So the combination of both is where you should be. Digital Smile Design is a great platform that has helped a lot of dentists, young dentists, inexperienced dentists, very experienced in all classes. It's helped them to achieve consistent outcomes, but it's also has made him into a mentality that everything needs to be a step 1, step 2, step 3, and everything is just like repetitive. You know, you need to have a protocol of what you do, but you need to start also looking at people, looking what looks right. Don't tell me you're gonna put a tooth here because it needs to be 0.5 from this. You know, like take a look at the person. I have a lot of people that tell me, like, for example, like, how much do you open a bite? And I know my parameters. You know, I know my shimbashi. You need to be between 17 and 19. I know what looks normal. I know the rules. I know them. But how do I open a bite? I look at the patient.
Yep.
I add composite, and I have the patient close. I add a little bit more, and I have the patient close. And then I put side by side, and I look at the patient from the side, and I have them close. And do they look normal? Yes. So I should be right. There's not exact science.
Everybody's gonna have a different
Everybody's
way.
different. So you just have to make it work to the patient. It needs to function correctly. You need to be within a certain parameters, but you need to look at the patient and just open your eyes and not be guided or not be so close-minded into one way or the other. You need to learn it all, and you need to be able to take it in, and you need to know what else is out there. So the whole DSD is a great platform. I really enjoyed. I enjoy the way they design smiles. I also, you know, the way that we do it in our office. It has a lot of creativity. It has a lot of touch to it, a lot of personal touch, and it's more artsy. And I like that personally more. But it doesn't mean that I'm right or you're wrong. It's just that's just the way that it works for me. But just in general, just be open to anything.
Yep.
That's what my biggest take.
What about you, Bart?
So, I mean, I've known Appa since 2016 when it was Rosenthal Appa. And then he didn't even have the office in Dubai. And when he said that, we all thought he was crazy. And then he opened up LA, and now he opened up Miami. So, you know, my hat goes off to Mike. He's He is the leading standard, the epitome of cosmetic dentistry. And following him to the course that we just took last weekend, I found it interesting that he said, you know, you should Google your patients, get to know who is coming into the chair. Because I never did that. For me, I almost felt like it was like I was violating because I was just like, oh, I'm Googling this patient. But now that I do that, I'm getting kind of scared now because I'm like, this patient is worth how much? I'm not thinking.
Puts things into
before I didn't
perspective.
I didn't even care before. I'm like, all right, patient's in the chair. I'm gonna go in, get him done, do this. Now I'm like, oh no, this patient is like. But no, it was nice to see that the dynamic between Coachman and Appa. It was like yin and yang. I like seeing the book smart and all the research, systematic reviews, and it might coming in and say, hey man, I got 40 years of pictures. I know what works. Get the systematic review out of my face. This is what works. I'm going to do it this way.
Well, there's clinical backing.
Yeah,
right? And
exactly.
It's proven to work, right?
Yeah.
But each style has its benefits. Its
Yeah,
pros
of
and
course.
cons.
Yeah.
Right.
You're still going to have failures. Like nothing in life is 100%. And that's what I begin to realize, especially working here. Like you get a bunch of wins and then you get an L, but you got to take that L because humans are humans.
That's how
if
you
they're
do it.
destroyers, they're destroyers. They're going to break things left and right. You know what I mean? You got a, Louis Vuitton on, but you're walking like this all over the place. And
I think that point is a pretty important thing that most people don't talk about with their patients.
Yeah.
You have to set an expectation of what this treatment is.
yeah,
Because if you have somebody that's come in and they've ruined God's teeth. When it comes down to it,
100%.
you're putting in a piece of porcelain to restore what they've lost, but they're going to have to alter some of their behaviors as well.
100%.
There has to be protection. There has to be upkeep with what we're doing.
As Mike said, you have a Ferrari in your mouth. Don't
take
go
it.
off-roading.
Yeah.
yeah,
You know?
Exactly.
For
That is
whatever
true.
reason in dentistry, I don't know how this standard was set, but people think I got this filling done or this veneer or this crown. This should last me forever.
yeah.
Meanwhile, you get a car every 3 years. You
Well,
get a
no,
phone
you get a boob
every
job.
year.
You got 10, 15 years on that.
You get a knee surgery.
Yeah,
People go get a revision.
yeah,
You get shoulder surgery. Oh, it didn't work. Got to do another one.
yeah.
But for some reason,
And you get charged for it too.
exactly right.
Exactly.
In dentistry,
it's
it's people think I got this tooth, which you use your teeth every second of the day, every time you move your mouth, and I think setting expectation and making sure the patient understands what the treatment is just as important as doing the treatment.
So what I learned from actually Dr. Naif Sonata, shout out to Sonata, is that I now tell the patients that, listen, there will be revisions in the future. We should get at least 10, 15 years out of this. But, down the line, something needs to be done. I'm here for you. This is a journey we're taking forward
I love that.
together.
I love
but
that.
there will be revisions. I mean, my favorite pair of jeans, I don't have them anymore. My favorite pair of shoes, I don't have them anymore. My car, I just got rear-ended the other day. I'm not going to have that soon anymore. So it's just like nothing in life lasts forever.
But I think it's setting that expectation that is the key. Letting the patients know that nothing lasts forever. Not even we do. Everything will break down, decay.
With
break.
that experience, I'm going to be there for you.
Correct. And that's when the key happens. So for all my patients, for example, they all have my cell phone.
Oh, they got my cell phone too.
I called them today. So it's the matter of them feeling safe, right?
Yeah.
Because we're in an environment where people are scared.
Yeah.
And them feeling that you're there for them, that they're safe. If something happens, you're going to have their back.
Yeah.
That's the key,
Yep.
right? So when you're doing these big cases, you can't just set it and forget it.
Yep.
You have to
Yeah.
know that you're now committed to this person for
Oh, yeah.
X amount of years.
yeah.
Oh, yeah.
And they are your patient.
Yep.
Or anybody that you put a handpiece to, that you take care of, that is your patient.
Yeah.
So it's your job to not only give them the respect, but the passion that goes beyond the loops, I like to say.
Yeah.
Right? Because it's easy to do the work. It's harder to manage it.
Yeah.
So get into something that you can manage and take care of your patients always. And that was one of the take homes for me, was not only everything that you guys said was huge, and it was incredible to see over almost 500 people
Yep.
Yeah.
in that auditorium. And it was incredible. But we have one person in this group that has gone through a smile design.
Oh, that's right. That is right.
So I think that we want to hear from a patient's perspective how the experience was for you and how it's changed your life.
Well, I come from a country where there is not a lot of education on this matter, and there's not enough technology to do what you guys do. So since you guys did, in my case, you got to see really what was going on with me. So I had a lot of issues with my teeth, for so many years, and it's sad that it got to this point, but I didn't have the information. I didn't know really what I needed to get done, how to do it. And which, by the way, meeting you guys has been the best thing that has ever happened to me. Yeah, it changes your life, your perspective, and the way that you spread out information, And my experience has been, first of all, has been amazing. I never had an experience like this before. It's been a disaster, prior experiences, but I was very self-conscious about my smile, the color of my teeth, the structure, my bite. It's just everything, and it stopped me from doing a lot. I look back and I'm like, wow, I could have gotten this job. I could have done that photo shoot. I could have, but I didn't have the confidence.
And now she's glowing.
Yes.
I am glowing, and also
I see her on Instagram. I see her on Instagram, and she is always
Glowing.
I am like, why?
Glow, Ellie, glow.
I know, and I honestly, I love it. I feel, much better about myself, the way that I, approach everything in life.
Oh, that's
it's
awesome.
just like 100% confident, when you look at somebody's face, every part of your face, your first, second, and third part of your face has, the specific thing that makes you beautiful. Your eyes, your nose, teeth are this right here. It's just so important, and I'm very, very happy.
I'm happy that you're happy.
Very.
And that's a great
That's
way
great. Yeah.
to kind of circle back to this whole conversation of what is cosmetic dentistry. It's education, knowing your patient, knowing their wants and needs, taking care of their health first,
Yes.
and then their aesthetics all combined, facially driven, right? Planning everything, doing the temporization so that the lab could create an exact replica of what you visioned, right? Having the end in mind always, so that you could get an end result of someone that had such a bad experience in life and in dentistry to now an amazing experience.
Yep.
And seeing you smile on your Instagram posts makes
the
my
time.
day every day.
And,
So
and I'm gonna say something for dentists, and I'm gonna say something for you. It's going to break at some point. And I'm going to be here to fix it. I am going to fix it, and I will feel okay.
You know
It's
what?
okay.
I get this question all the time. Oh, you got veneers? Oh, you're good for life. And I'm like, no, nothing lasts
Yeah.
forever.
Yeah.
There is a
Yeah.
downside to it. But, podcasts like this, who educate people and give
Awareness.
accurate information out, because there's a lot of information on the internet. Don't believe everything you see. So podcasts like this, who really give you information and train people, and encourage practitioners to do the right courses and take the right path, it really helps. It changes things, especially for people like me, who need people like you with the knowledge to make me feel better about myself and change my life.
it's awesome. That's what it's all about.
Yes.
Yep.
I think this is where we say goodbye.
Yeah.
So
Got it.
thank
It's
you,
a wrap,
everyone.
guys.
Thanks
Thank you for
us.
watching.
Thank you for joining in.